Williams, how are you today?
Good.
Good. Well, my name is Natalie, and I'm going to be your nurse today. I was wondering if you don't mind confirming your full name and date of birth.
Norma Williams, 12345.
Good. And do you have any allergies?
No.
Okay, perfect. Miss Williams, I have a couple medications that Dr. Gatsby ordered for you. Is it a good time to go over them?
Mm-hmm.
Okay, it looks like the first one is ceftriaxone, which is an antibiotic. I heard you had a kidney infection, so they've ordered that for you. And we will be giving that to you deep IM, which will go in this muscle. It's called the ventrogluteal, and we'll be doing that today. Is that okay?
Mm-hmm.
Okay. The next one I have is a flu vaccine. It's time for your yearly flu vaccine, and we'll just inject that into the deltoid muscle right here on your arm. Then I have regular insulin. I saw that your blood sugar this morning was 175, so I'm going to go ahead and give you that. Do you mind calling for your breakfast tray?
No.
Okay, go ahead and call your breakfast tray. That way, right after I give you that insulin, you can eat. Okay? And that would be 10 units of regular insulin and 5 of your NPH. And I'll just combine them and give them to you in one shot. And I think I saw the last time you got your insulin, it was behind your arm.
Mm-hmm.
Today I'm going to give it here in your belly, okay?
Okay.
Okay. Then the last shot I have for you is your tuberculin. It's 0.1 milliliters intradermally today. And that's a diagnostic test. And we'll use your forearm here. And we will give it to you right in this area. But with that one, I want you to make sure you come back in 48 to 72 hours so that we can read the results of that tuberculin diagnostic test. Great. Do you have any questions?
No.
Okay, you've got your call light. I'll lower your bed, and if you need anything before I get back, don't hesitate to call. Okay, now that I have confirmed all the medications with the patient, I'm going to proceed to the nurse's station and collect the correct syringes. And verify with my MAR, Rosefin, that's going to go deep IM. So I'm going to need a 22 1.5. And to draw it up, I'm going to use the 23 gauge with a 3 ml syringe. And that will be my Rosefin. For my flu, I'm going to also need a 23 gauge, 1 inch with a 3 ml syringe. For my insulin, I'm going to get an insulin syringe. This is a 50 unit syringe. That'll be used for my insulin. I just need one because I'm going to combine the regular and NPH. And then for the tuberculin, we're going to get a tuberculin syringe. And this is a 27 gauge, 1/2 inch needle. Okay, I've just returned from grabbing all my needles that I'll need. And now I'm going to start with my first check. And we are going to do Rosefin. And that is in drawer 2N, patient's personal drawer. Rosefin. And then first check, Norma Williams, 1, 2, 3, 4, 5. No known drug allergies. We have Rosefin or ceftriaxone. And it's 2 grams deep IM every 12 hours times 4 days starting 9/15/24 at 0900. And this is Rosefin, 1 gram per 0.5 milliliters. We need 2 grams, so we're going to pull up 1 milliliter. Expiration is 4/41. First check done. Then flu. Okay, Norma Williams, 1, 2, 3, 4, 5. No known drug allergies. I have the flu vaccine, 0.5 milliliters, IM times 1 today at 0900. And this is the influenza virus vaccine, 0.5 milliliters. And it expires 2/25. Insulin, regular, and NPH. So it's going to be found here. Door 2. Okay, 2 different medicines, so we're going to do 2 checks on this. Norma Williams, 1, 2, 3, 4, 5. No known drug allergies. We have the regular insulin, 10 units, subcutaneously BID at 0900. Regular insulin, not expired. And Norma Williams, 1, 2, 3, 4, 5. No known drug allergies. We have NPH, 5 units, subcutaneously BID at 0900. NPH, and not expired, and it should be cloudy. Okay, and then my last drug, tuberculin, in the patient drawer. Norma Williams, 1, 2, 3, 4, 5. No known drug allergies. I have tuberculin, 0.1 milliliter intradermally times 1 today at 0900. And this is tuberculin, and it is not expired. Now I have my meds ready, and now I'm going to go to my second check and prepare. So our flag will consist of patient initials, Norma Williams, medication, name, Rosefin, and medication dose, 2 grams. We have influenza. Dose 0.5 milliliters and patient initials. Then we have insulin. We have NPH, 5 units, and regular, 10 units, and patient initials. Then we have TB. We have 0.1 milliliters and patient initials. Okay, so I've just finished making all of my flags for my medication, and now I'm going to do my second check, and this is the prepare stage. So for my first medication, the Rocephin, before I prepare, I'm going to do my second check. Norma Williams, 1, 2, 3, 4, 5, no known drug allergies. I have ceftriaxone or Rocephin, 2 grams deep IM every 12 hours for 4 days starting 9/15/24, and this is her 0900 dose. Use a little alcohol sanitizer. Gloves aren't needed, but can be used if you prefer. And I'm going to take my syringe and attach it. And I need 2 grams. And again, I'm checking my med vial. It's already been opened. I'm going to clean the top. Okay, and let that dry. And since I'm using 1 milliliter for the 2 grams, I'm pulling up 1 milliliter of air and injecting the air into the vial. And inverting the vial and drawing up 1 milliliter of Rocephin. I like to go past the 1 milliliter mark. That way I can eject any bubbles. So right now I'm about 1/2. And I put all the air to the top. And I'm gonna leave a tiny bit of room, just over 1 mil, for my new needle. And I'll bring a drop to the top with my new needle. So on the new needle, and I'm gonna make sure I prime the needle because I don't wanna inject air. And that tiny bit, I'm gonna look through the cap and get that drop at the top. Perfect. And now I'm exactly at 1 milliliter. And I'm going to go ahead and put on my flag that I've already created. And I'm going to put it down below so it doesn't obstruct my view of the dose. Rocephin. And I'm not going to put it on the plunger either. And that second check for my flu vaccine. Starting with the paper, Norma Williams, 1, 2, 3, 4, 5, no known drug allergies. This is her flu vaccine, 0.5 milliliters IM times 1 today at 0900. This is her flu vaccine, 0.5 milliliters, yes. And I'm going to clean the top. And let that dry. I've done my second check. I'm opening my packaging. Again, I said 0.5 milliliters. So once I've attached my needle, I'm going to draw up 0.5 milliliters or 1/2 of a milliliter. And I'm going to inject that air into the vial. This has dried. I'm going to invert the vial and pull up 0.5 milliliters. Again, not too concerned about the bubbles at this point. Now that I'm done pulling up much more than 0.5 milliliters and I've flicked the syringe, I'm going to push out all the excess air and bubbles. I'm going to label. This label lets me know that I've done my second check on my medication. 0.5. Okay, now it's time to do our prepare second check for insulin. We have Norma Williams, 1, 2, 3, 4, 5, no known drug allergies. She gets regular insulin, 10 units subcutaneously, BID at 0900, and this is regular insulin, and stating the expiration 1/2027. So we can go ahead and prepare that. We are going to give NPH as well. So Norma Williams, 1, 2, 3, 4, 5, no known drug allergies. We have NPH, we're going to be pulling 5 units subcutaneously, BID at 0900, and these two we will prepare together. We'll make sure before we pull up the NPH that we agitate it a little bit by rolling it in between our 2 hands. Okay, now we'll prepare our insulin. So I am going to wipe the tops with an alcohol swab. I've already agitated my NPH, so it's all combined. drawing up 5 units of air, injecting that air into the NPH, drawing up 10 units for the regular of air, injecting that into the regular, flipping over the regular, and drawing up 10 units of insulin. Okay, so you will be my nurse. Nurse, what do you see? And you will say 10 units of regular. Okay, now I'll go into the NPH. It's clean, ready to go. And I have to be very precise and pulling up 5 more units. And I'll say, nurse, what do you see? I see 15 units, and that vial's NPH, so that means you've added 5 units of NPH. So 10 of regular and 5 of NPH, and now I have a total of 15 units of insulin in this syringe. We're going to scoop our cap. Okay. And now we're going to apply our label. Do not apply up here. Do not apply on this plunger. Apply right below. Insulin, NW, 10 units, regular, 5 of NPH. Okay, second check for tuberculin. We have Norma Williams, 1, 2, 3, 4, 5, no known drug allergies. We have tuberculin, 0.1 milliliters intradermally times 1 today at 0900. And this is my tuberculin. And I'm going to give 0.1. And the expiration date is 2026. So I'll go ahead and prepare that. Off the top. And let it dry. Get my syringe ready. This is a tuberculin syringe. It's a 27 gauge half inch needle. I'm going to draw up 0.1 milliliters of air. Now that my alcohol is dried, I'm going to go ahead and insert the air, invert the vial, and pull back 0.1 of tuberculin. Swoop method to recap. Once that needle is no longer exposed, secure the cap. I'm going to signal to myself that I've done this final or second check with my flag, and I've prepared all my medications. They all have the proper identifying label, and before I leave my medication cart, I'm going to return all of my medicines to the proper place. Alcohol swabs to Miss Norma's room, cotton balls, and Band-Aids. All of this is in drawer 3.
Come in.
Hello, Miss Williams. How are you doing?
Good.
Good. I've come back with all the medications that we talked about. If you'll excuse me, I'm going to go to the other side of your bed and get some gloves. And let's just confirm again your name and date of birth.
Norma Williams, 12345.
Oh, very good. Miss Williams, just for your safety, do you have any allergies? Just want to confirm.
No.
No allergies. Okay. Okay, Miss Williams, I'm going to do my third check on the medications that we already went over. And here I have Norma Williams, date of birth 12345, no known drug allergies, and I have her Rocephin, 2 grams DIM every 12 hours for 4 days starting on September 15th at 0900, and this will go in her ventrogluteal. And this says Rocephin, 2 grams equals 1 milliliter for Norma Williams, 12345. Good. I'm just going to go ahead and check all my medications so we can get to the administration in just a minute, Miss Williams. Then I have Norma Williams, 12345, no known drug allergies. I have her flu vaccine, 0.5 milliliters IM times 1 today at 0900. 0.5, and this is her flu vaccine, 0.5 milliliters for today. Okay, that's good. Next I have for Norma Williams, 12345, no known drug allergies, regular, insulin, sub-Q, BID at 0900, and Norma Williams, 12345, no known drug allergies, NPH insulin, 5 units sub-Q BID. This is the 0900 dose. And since your blood sugar was 175 and I heard you ordered breakfast, it's on the way. I'll go ahead and give that to you. The next is for Norma Williams, 12345, no known drug allergies, tuberculin, 0.1 milliliters, intradermally times 1 today at 0900. And this will go in that left forearm, which you'll come back 48 to 72 hours for us to read that tuberculin 0.1. Perfect, and that is a match. Okay, Miss Williams, we're going to go ahead and inject those medications. Any other questions that I can help answer before we give those to you?
No.
Okay, I checked these medications 3 times, and they are good to go. So let's go ahead and start with the ventral gluteal. If you don't mind, I'll have you turn and face the window. And when I am looking for your ventral gluteal, I'm going to have you bend that knee up. Very good. And I'm going to put my palm on your greater trochanter. I'm going to put my thumb towards your groin. And I'm going to put my pointer finger up towards the anterior superior iliac spine and my middle finger up towards the iliac crest. Spread the fingers, and I'm going to inject right there into that muscle. And the reason we do that is because there's not a lot of veins or big blood vessels. Okay, now we're going to clean our hands with alcohol and administer the Rocephin via Z-Track. We're going to put on a fresh set of gloves, and we are going to get our medication ready. This is our ventral gluteal site. Z-Track method is preferred for deep IM for medications that could be harmful for the surface of the skin. We're moving our skin over first, and then we're going to cleanse while our hand is in place. We're going to pull the cap off with our dominant hand, inject at a 90-degree angle, remove the needle from the skin, and then move the hand and engage our safety cap. You did great. For this next shot, we're going to go ahead and do the flu vaccine, and that's going to go into your deltoid muscle. Your deltoid, I'm going to find that by finding your acromion process and 3 fingers down. I'm going to go. Okay, the next shot we're going to give is in the deltoid muscle. It's the flu vaccine. First, we're going to cleanse with the new alcohol swab from the middle to the outside and let that dry. Now that we have all of our supplies gathered, we're going to get ready to inject our flu vaccine. We use one hand to brace the arm and go in at a 90-degree angle, pushing in the medication, grabbing our cotton ball, covering any bleeding, engaging our safety cap, and then placing a Band-Aid. Okay, Miss Williams, very good. The next shot I have for you is your insulin, and that is going to go into the subcutaneous tissue. The other 2 were intramuscular. This is sub-Q, so it can go on the back of your arm or in your belly. You said you had it in the back of your arm yesterday, so today I'm going to go ahead and do it in your belly. I'm just going to bring that down. I'm avoiding around the belly button area, and I'll just get an alcohol swab and cleanse that. Okay, here we have our insulin. It can be injected in the upper back of the arm or in the belly. We'll cleanse from center out. We will either inject at 45 or 90-degree angle depending on how much fat tissue your patient has. We're going to pinch up the skin and inject and remove our needle and engage the safety cap. The next shot I'll be giving is your tuberculin, and that goes in the left forearm. It's intradermal, so right below the skin. I'll barely even pierce that skin. And I'm going to show you a left forearm right here. I'm going to take my hands and place them in the antecubital and above the wrist, and I'm going to aim for this middle area, avoiding any superficial veins or birthmarks. Now it is time for our TB. The most important thing is to have the bevel up when administering TB. The angle for TB is at a 5 or 15-degree angle in the left forearm. We're going to be almost flush with the skin. Our needle is going to go right under the skin. We'll inject the medication, form a wheel, take out the needle, and engage our safety. Very good, Miss Williams. You did a great job with all your shots. Do you have any other questions before I leave?
No.
Okay, just to make sure you don't have any sort of reaction, I'm going to come back in about 20 to 30 minutes to check on you. Please let me know if you feel short of breath or any swelling anywhere, but I'll be back to check on you. Thank you. Here's your call light. Hello, Miss Miss Williams. How are you feeling? It's been about 30 minutes since I gave you those injections. How are you feeling?
Perfect.
Good. And I saw your breakfast tray is all completely done, so you ate breakfast?
Mm-hmm.
Good. I'm so glad. Is there any other questions or anything I can help answer for you?
No.
Okay, well, you did a great job. Thank you so much.